I hate needles, but blood sugar monitors have become so advanced today that even someone like me can take their blood sugar reading at home. So I tried something. About a year ago, I ate a series of items which I was very sure would not spike my blood sugar at all. I had momos, I had pork ribs in barbecue sauce, I had a cheese sandwich, and a paratha. Now, all these items were not made at home, but I also didn't order them from fast food places. I got them from fairly high end, high priced restaurants. And I ate each on a different day, a different time of the day. Now, none of these were desserts. And very often I would go to a restaurant and I would order these thinking, these are fine, these aren't going to affect my body at all. But after about half an hour of eating each, my sugar was higher than normal. I made myself into a human guinea pig for a reason. I wanted to be very sure that before I take the decision to eat food from outside, no more than once a month, that such food was actually having a negative impact on my well being. And it was. This is Sonali Acharji, and you are listening to Health Wealth, a podcast that wants to help you feel super motivated about your well being. And how do we do this? Through facts and practical advice. So, for me, the most impractical advice in today's time, and I'm talking about a moment in human history when, for those who can afford it, food is everywhere. So, to simply say, eat little, eat balanced, cut out sugar is not enough. If I'm going to attend, say, a holy celebration where everybody is eating deep fried refined flour dunked into thick sugar syrup and stuffed with more sugar, and I have to say no, I have to turn away from that table and explain that I'm sorry, I only spike my blood sugar thrice a day, and so I can't eat now. Or I'm sorry, all this food is super easy to digest and it'll spike my blood sugar very quickly. So can you give me a carrot to eat? If I have to do this, I need a very good reason. What worked for me is getting to know what is diabetes. If we have so many excellent drugs to treat this condition, to the extent of insulin pens today, even calculating the dosage for you. So, even someone who's terrible at math like me, I can medicate myself. So then why do I need to worry? If my body fails, my doctor will step in, right? But here's the thing, even with medicine, this disease can do a lot of harm. There's some amount of public awareness that poor blood sugar will impact your vital organs like the heart, the kidney, or the brain. But look into the details. It causes blindness. It ruins your digestion. It can cause your brain to shrink so that if you get diabetes at 30 today, 3 decades later, if we're all traveling by jetpacks and meeting people through AI, your brain might even be too damaged to learn how to operate these wonderful new possibilities in life. I went through some reliable research on the impact of diabetes. And aside from what I just mentioned, it's also linked to severe central scalp hair loss in women, dry skin, high risk of low bone mass and thus more chances of fracture. It can damage blood vessels in your ears and impact your hearing. It can cause fungal infections in your nails and genitals. If you hurt yourself, it takes longer for the wound to heal if you have diabetes. The medicine will keep you alive, but the quality of your life is going to go down the hill. And this is worrying from an individual and public health perspective. There was a decade-long study of Indians and literally took a representative sample of Indians in every state in this country. It was conducted by ICMR and the Madras Diabetes Research Foundation. And it estimated that about 11.4% of the country's population are living with diabetes, and another 15.3% could be living with prediabetes. So today we're not going to discuss it from a public health perspective per se, but more from an individual's point of view, so that we can get to know the basics of what is this condition, how does it start off, and really, why should I worry about it? I have with me today Dr. Ritesh Gupta. He's the Director of Endocrinology and Diabetology at Fortis Hospital in Chirag, Delhi, which, if you haven't already guessed, is in Delhi. Hello, sir. How are you?
Hello. Yeah.
Thank you so much for your time today. There's something I've always wanted to ask a doctor who treats diabetes. And if you don't mind sharing, how often a day do you take your food?
Yeah, that's a valid question. Yeah. So, how often a day? Again, a debatable question. How
Mm-hmm.
often one should take?
Right.
With all the talk of intermittent fasting
Mm-hmm.
and all kinds of diets, and then the traditional advice that diabetics should eat frequently.
Mm-hmm.
So there is some kind of a problem there. So yes, the traditional advice, and in my opinion, the most scientifically sound advice is that there should be frequent meals. And when I say meal, it doesn't mean a full uh, carbohydrate rich meal or anything. So three major meals and three minor meals. This is a basic dictum for most people. Three major: breakfast, lunch, dinner, and a mid
Mm-hmm.
morning snack, and an evening snack, and a bedtime snack.
Mm-hmm.
When we say snack, it could simply be a fruit, just
Mm-hmm.
an apple or something, or a few nuts, or a cup of milk. So that is a snack. But then this sometimes needs to be individualized depending on a particular patient's profile, also the lifestyle. There are certain things which are not possible, which are the work or the daily schedule doesn't permit many people to eat that frequently. So all that can be modified. Also, the kind of diabetes medicines one takes,
Mm-hmm.
that would also determine what kind of food and what at what intervals one should eat.
Right.
So yeah, so that is. But yes, I try to eat. I try to maintain this schedule. Yeah.
Yeah. And I suppose if we are to start at the absolute basics of things, could you maybe explain what happens when I eat? What happens? What are these hormones that come off? What is the reaction that happens within the minute I put food in my mouth?
Yes. So the moment one eats, first thing is the food gets broken down into its individual components. You
Mm-hmm.
eat a paratha or a slice of bread, so that's carbohydrate. Then you have protein, you have fat. So all these basically are complex things. So they get broken down into simpler fragments. So carbohydrate will get broken down to glucose, and then that will get absorbed. So that will get absorbed through your capillaries in your gut, in the stomach and intestines. And the moment it gets into the blood, there is release of certain chemical substances. Commonly, we call them as hormones. So insulin is, of course, the most important thing, but then there are many other hormones which are involved. But we'll basically talk about insulin.
Yeah.
So what insulin does is it makes the excess sugar. It
Mm-hmm.
makes the sugar enter your cell.
Mm-hmm.
So once the sugar is in the blood, the
Mm-hmm.
glucose is in the blood,
Mm-hmm.
the it needs to be utilized. The glucose needs to be utilized to produce energy. That's the purpose of food, to
Mm-hmm.
produce energy. So insulin makes the glucose molecule to go inside the cell. So
Mm-hmm.
it's like a key. It opens the lock. So the glucose goes inside the cell, and then the energy is produced, and that energy is needed for everything, for vital organs, for all our activities. But once that energy is in excess, so the intake is too much, the calories are too much, then that gets stored mostly in the liver as glycogen, or in the fat, in the fat tissues. So there is buildup of fat around the abdomen and all over the body, and even inside our abdomen, inside the organs, inside in between the organs,
Mm-hmm.
there is buildup of fat, and that is what is a problem.
Mm-hmm.
So otherwise, in a normal circumstance, if all the hormones are working and if you're eating healthy, then it's as simple as just taking
You
food,
just,
getting
yeah.
energy, and that's it.
And what is insulin sensitivity? Because that is also something, which is quite confusing to an average person. What happens to the insulin? How does it become sensitive or insensitive?
Yes. So having insulin is not enough. There are people who have normal insulin, or in fact even higher insulin than normal,
Mm-hmm.
but their bodies or their cells or their tissues do not respond properly to insulin. So there is resistance. It's a very complex way in which insulin, complex pathway in which by which insulin acts.
Mm-hmm.
So people are resistant to that. So the insulin is not able to act.
Mm-hmm.
The most important reason for that is obesity, being overweight.
Okay.
So if the weight is more, insulin is unable to act, and that creates a barrier. So
Mm-hmm.
to compensate for that, the body produces more insulin.
Mm-hmm.
So sometimes one is able to that increased insulin is able to counteract that effect, that resistance.
Mm-hmm.
But if it is not, then one develops diabetes,
Right.
basically.
And is diabetes the inability to produce insulin or the fact that your cells are no longer responding to the insulin you have?
Both, actually, both.
It's both.
It's both. So there
Okay.
is something called type 1 diabetes, in
Mm-hmm.
which the body doesn't produce insulin
Mm-hmm.
with, with, without any fault of yours. It just stops producing insulin,
Mm-hmm.
often seen in children. Not very common. It's a rare disease. So when we talk of diabetes, as you were saying, in India, it's increased to a great degree. We don't talk about type 1 diabetes. We're mainly talking about type 2 diabetes. But even in that diabetes, it's both. It's both insulin resistance and insulin deficiency,
Right.
especially in us, in Indians.
Mm-hmm.
There's a great deal of insulin deficiency which sets in because our people come late to the hospital. They seek medical advice much later. So by
Yeah.
that time, the insulin has already started getting depleted.
Mm-hmm.
So it's both. But yes, in the initial stages, it is mainly the insensitivity or what is called insulin resistance which is responsible.
And you mentioned you know, obesity or fat being one of the, risk
Hmm.
factors. Is Are things like other hormonal imbalances, say one develops thyroid problems, or during menopause, when your other estrogen, all these hormones
Mhm.
might not be in balance, do these also end up impacting your insulin?
Sure, sure. Menopause, yes.
Mhm.
To some extent, it is said that women are a little less prone to diabetes before menopause than men prior to menopause. But yes, after menopause, the risk is same as men. So
Mhm.
female hormones are in a way protective as far as diabetes is concerned. In fact, as far as other metabolic disturbances like heart disease and
Mhm.
cholesterol are concerned. Not just menopause.
Mhm.
Many young uh, women, young girls have what is called PCOD, polycystic ovary disease, and that also is a feature of insulin resistance. So in that condition, also the woman is likely to develop diabetes at a later life, and then obesity, of course, is a risk factor in all age groups,
Right.
and that also acts through many a times through hormones only. Yeah.
And so, say before menopause, if I was eating a certain diet and it wasn't impacting my blood sugar much, but post menopause, do I then need to keep an eye on my average 3 monthly blood sugar, and do I need to modify my diet? Will the same diet, perhaps I was eating like say 4 puris a day or something of that sort, would that same amount then end up giving me diabetes post menopause?
Sure, sure. That does happen after menopause, yes, but in general with age as well,
Okay.
even in men. So as you age, the risk of every chronic disease increases. So it is intuitive that yes, one should take more care as one ages. Though
Mhm.
what I always say is that it's in fact in the early age that you need to take more care so that you don't end up with these problems later on
Yeah.
in life.
Yeah.
But yes, after menopause, one needs to take more care of what one needs. Yeah.
And how do you monitor your blood sugar? See, I do my 3 monthly average check once a year. Does it have to be more frequent, say, post 45? I'm 35 now. Do younger people need to do it just once a year? Do you do it more frequently as you age?
Once a year is fine. If you are otherwise fine, if you don't have any other symptoms, as a screening thing in the general population, they say that in fact in younger people one could even check once in 2 years. But yes, after the age of 40 or 45, one should check at least once a year. And if but in case there are symptoms like one loses weight all of a sudden without any effort, one is losing weight, the
Mhm.
appetite is going up but the weight is going down, or if one has other warning signs like increased frequency of urination or marked fatigue or as you said less wound healing, delayed wound healing.
Yeah.
So all these symptoms should prompt you to check sugars in any case. But otherwise, in a healthy person, once a year should be fine. And if there's a strong family
Yeah,
history,
I was gonna
then
ask.
then
Yeah.
of course you need to check much earlier, much sooner.
Now, supposing there's a strong family history, does it matter more if the mother has diabetes or the father or either, or if a grandfather has, is that also a family history of diabetes? What is family history exactly? Because sometimes it's just used very widely, and
Yes,
if
yes,
my
yes.
great grandfather had it, is that family history?
Well, anyone in the family having diabetes would increase the risk, no doubt.
Okay.
But the maximum risk is with the first degree relatives,
Got it.
father, mother, and siblings.
Siblings as well.
Many times patients tell me, oh, my father has diabetes, but he developed it at the age of 60. So, but even if he developed at the age of 60, you are at risk. That means it's there in the genes. So of course, you were born much before he developed diabetes, but then the risk is there. So, first degree relatives having a disease confers the greatest risk. It doesn't matter whether it's father or mother. Uh, Either would affect your risk to the same degree. But yes, if both of them have diabetes, then the risk is much greater.
Yeah. In fact,
Yeah.
now I believe there's some genetic tests as well, which allow you to check if you have a gene for diabetes or your risk for diabetes.
See, it's not a single gene, but
Mhm.
but there are so many genes which
Yeah.
which tell our which basically determine our propensity to develop diabetes. There are some tests, but they are far from being very accurate,
Right.
because it's a multi-genetic disorder. It's not like color blindness or
Mm-hmm.
things like that where there is one gene and it's transmitted.
Mm-hmm.
It's always an interplay between gene and environment. So nature
Yeah.
and nurture both.
Mm-hmm.
So you may have the genetic predisposition, but you may never develop it if you take
Look
care of your
after it.
lifestyle
Yeah.
well. Yeah.
Yeah. And and now supposing I've done my test and it mentions that I'm pre-diabetic.
Mhm.
Do I need to take care of this now on my own? Should I go to a doctor? And what are the chances that I can now avoid diabetes if I take the steps?
There are chances. There are, of course, chances that you may never develop diabetes, even if you have prediabetes.
Mhm.
Yes, you should go to a doctor, not just for treatment of prediabetes, but also to rule out other associated conditions, because
Right.
it doesn't come alone. So if one
Mhm.
is pre-diabetic, one may also be harboring some other risk factors for heart disease, like high cholesterol or high blood pressure. So there might be some simple examinations and tests which might be needed to determine your risk accurately, your risk of heart disease. After all, we are treating diabetes or pre-diabetes to prevent a heart attack.
Yeah. Yeah.
So we need to do that. Uh, the key is lifestyle, of course.
Mhm.
So again, careful attention to diet and physical activity. Weight management is important, but yes, in some cases, even medicines are prescribed in people with pre-diabetes, but they are not mandatory. Many a times, most of the times, people are able to manage without medicines.
Right. And supposing I've got diabetes, God forbid
Mhm.
I've developed it. If I do not take the medicine and I just let it be, what's the most likely impact on my health going to be like?
See, untreated diabetes would increase the risk of complications.
Hmm.
So, complications, as you enumerated,
Hmm.
mainly related to heart, kidney, brain, also eye, retina,
Yeah.
and also the nerves in your feet and hands,
Hmm.
mainly feet. And that makes you prone to injury and gangrene and all those things. But the most important thing to realize is that it's very important to control sugars very well soon after diagnosis.
Hmm.
So the first 5 to 10 years after diabetes diagnosis are very crucial. So, so it's something called memory, metabolic memory. So
Right.
whether you generate a good memory or a bad memory for the body to remember. So if your sugars are very well controlled after diagnosis and they are well controlled for 10 years, then the risk of complications even after 50 years is not so high.
Hmm.
On the other hand, if you don't control for the first 10 years, you're diagnosed at 30 and then you don't control it till 40, and then you say, I'm 40 now, I'll take more care. well, you can control sugars at any age, but then the risk would already go up. Even if you control sugars very well, the risk of heart disease would still be high. So that's the importance of early control and intensive control.
Right.
Yeah.
And when we do have high blood sugar, what is it actually doing? It's putting inflammation or stress on our organs. What does it actually do?
See, there are various ways in which high sugar can harm. One,
Mhm.
as you said, inflammation. Yes, that's the key mechanism by which diabetes influences or harms the various organs of the body. So there is inflammation. There is around the arteries. There is inflammation in the kidney, in the nerves, everywhere. Then there is deposition of not just glucose, but some glucose reacts with certain substances, and it gets deposited in the very small vessels all over the body. So that's how it basically triggers the harmful effects. And then it is associated with other things. It's associated
Right.
with high blood pressure, high cholesterol, that further increases the risk of heart disease and kidney disease, etc.
Yeah. You know, when I was researching for this episode, I was trying to find what are some associations of diabetes, which, I wouldn't have ever thought possible. And hearing loss was,
Yes.
something which shocked me. I wouldn't have ever
Mhm.
thought it possible. Um, is there anything in the recent years which you've read or come across which most people wouldn't know about how diabetes impacts your well-being?
One thing which probably people would know, but it's worth mentioning, is gangrene. That's
Okay.
a, I would rate it as even more serious than a heart problem. Heart
Mhm.
problem, at least nowadays, we have a solution. We have very good advancements in medical science, but gangrene is something which is very bad, and which is entirely preventable by
What
simple
exactly
measures
is
like
gangrene? Just for the
Hmm?
benefit of someone who
Gangrene.
might not
Gangrene is
know.
basically the blood supply to the feet gets
Mhm.
affected. The arteries which supply blood to the feet, they get altered, they get narrowed. The blood flow is not proper, so the blood is not reaching there. If there is an injury, minor injury, it could be just a new shoe bite or something, or it could be just a burn because you just put your feet on a hot in very hot water or something. You just burn your feet, and that injury, that wound doesn't heal, and the blood supply is also not proper. So that leads to basically death of the tissues around that wound, and that causes gangrene. And then sometimes it's serious, and one may need to amputate the limb, and even it may be fatal sometimes. So that is one
Gosh.
complication
Right.
which people should, with diabetes at least, should take care. And it's easily avoidable if you just take
Yeah.
good care of your feet.
Yeah.
And then, of course, there are other problems. There are problems like associated with brain stroke. Everyone
Mhm.
knows that there could be a
Mm.
stroke, paralysis, or something, but there are cognitive uh, impairment,
Mhm.
like person may be forgetful, person may not remember. There are associations with dementia as well of diabetes. There are some movement disorders. People may find it very difficult to move, to gait disturbances, uh, wobbly gait, and not able to stand from the uh, bed, or stand from the chair
Yeah.
properly, because the muscles in the proximal part of the limbs are not very working very well. So these complications are very well associated with diabetes, but we don't often talk about them. Yeah.
Right. And for those of us who might be listening who are looking to reverse diabetes, because there have been instances of that as well. So there are multiple number of methods that people try, and I really wanted you to help us distinguish myth from fact. So can you reverse diabetes simply through the food you eat, simply by changing your diet?
Mhm. Well, the answer is not straightforward.
Mm.
Not every diabetes can be reversed. So this is
Okay.
something to be remembered. If your diabetes is not getting controlled with diet and exercise, it may not be your fault alone. It's just that your disease is like that. So not every diabetes is reversible. Yes,
Mm.
some diabetes is reversible. Some people can reverse their diabetes. Uh, Again,
Is
the
it
key
possible
is,
through
and
food at all? Have you ever seen this happen? That,
yes,
somebody
yes,
just,
yes.
it is.
Yeah.
Okay.
Sure, sure.
but not
It can happen
100%.
through food alone
Okay.
as well. But it depends on the kind of sugars which you have. If the sugars
Okay.
are very high, then one may need medicine initially.
Mm-hmm.
Again, if you want to reverse diabetes, the key is to control it very strictly soon after
Right.
diagnosis.
Right.
So if you can achieve a very good control, the body recovers to some extent.
Mm-hmm.
But if already a lot of time has passed in when the body has had to bear high sugars,
Mm-hmm.
then the chances of reversal are much less.
Right.
The key is good sugar control. With diet, the key is caloric control. So you
Okay.
reduce your calories,
Mm-hmm.
and then that's the main crux of basically reversal in diabetes. There are various ways: intermittent fasting or
Yeah.
keto diets or calorie
Yeah.
restricted diet. But essential thing is restrict calories. That's the thing.
Mm-hmm.
Keto has some advantages, but then keto has some downsides also. It can raise
Yeah, I was going to
cholesterol.
ask you about keto
Yeah,
because that
yeah,
seems to be,
yeah.
the rage of the moment.
Huh.
And in fact,
So
it was
keto,
designed to
hmm,
control
to
diabetes.
control diabetes, to control weight.
Mm.
Keto has a role, but then keto should be under medical supervision.
Right.
If you have heart disease, if you have kidney disease, then keto may not be the best option. One may, and it should be under supervision because it can raise cholesterol, it can create other problems. Uh, again, as I said, the key is caloric restriction.
Mm-hmm.
And please remember that not everyone can reverse diabetes.
Right.
And not everyone can do it by diet alone. Even with the same amount of diet, even with calorie restriction,
Mm-hmm.
100% of people will not be able to reverse
Right.
diabetes. So
And
you need to
supposing
seek medical help.
I'm taking medical help. Supposing
Hmm.
I've come to a doctor and they've given me
Hmm.
insulin and some other medication. Can I reverse it with this medication but not changing my diet? Can I continue to eat whatever I want and just sort of assume that the external insulin will do its job for me?
Hmm. That's not reversal, actually. That's then you are on medication.
Okay.
So reversal means you're off medication. So for that to stay, you need to definitely alter the diet.
So diet is
And as
important.
that that's important
Mm.
also. See, it's not just the sugar we are looking at. Our ultimate goal is to prevent complications, to prevent a
Right.
heart disease. So even if your sugars are controlled with a lot of medicine and a lot of insulin, but the diet is not being controlled,
Mm.
then the inflammation and all will happen because you're eating unhealthy.
Right.
And the risk of heart disease will not come down. So sugar is just one part of it. So diet is definitely important. There's no second way about it.
And the other thing about calorie restriction
Mhm.
is the kind of calories you're getting as well, right? I can't just have like 1,300 calories of sugar and I'll be fine. So
Yes,
what is glycemic index? If you could explain a little bit about why that is also important to keep in mind.
that is important. So glycemic index basically means with what rapidity the sugar, the glucose levels rise after you eat a particular item.
Mm-hmm.
Uh, but that alone, that should not be again treated in isolation.
Mm-hmm.
Again, I would say caloric restriction. So it also depends on how much you are eating of that particular substance. Say for instance, fruits. Some fruits like watermelon has a very high glycemic index, but if you eat it in moderation, it is actually good because it's mostly water, and it has some fiber also, a lot of fiber actually, so it can be eaten. On the other hand, of course, a simple sugar, that is just glucose, and that would raise your sugars definitely, and that is something which is to be avoided.
Mm-hmm.
Rice, again, there is so much confusion that people often say that glycemic index of rice is higher. It's a little higher than wheat,
Yeah.
but then if you combine it with dal and with vegetables, as we do most in India, the glycemic index comes down. So it's not as bad. So it will again depend on how much you are eating. It's the portion size which is the most important.
Yeah, yeah. In fact, I think it's also the kitchen from where you are getting your food because I have noticed that, no, I mean, let's leave ultra processed packaged food out. I mean, that everyone knows is bad.
Mm-hmm.
But just regular packaged foods, things you never expect, like soups have sugar.
Yes.
And I once spoke to a chef off the record. I wanted to know what happens in these kitchens, and they said that um, the dough, the sauces, the cheese, it's all mixed with sugar. In fact, some of them have corn syrup as well.
Yes.
Because, in fact, I wanted to know, I said, how do I know where do I get my food from? Sometimes you want to eat out. And she said, find out what the philosophy of the chef is. If you're getting great quality ingredients, you don't need to mask it with sugar. You don't need to mask it
Yes.
with sauces and,
True. True.
so on and so forth. So I think somewhere that also plays a role, right? How much of control you have over, every single thing that's going into your plate.
True. True.
Yeah.
Absolutely. Absolutely. So as you rightly said, that corn syrup is a very common ingredient
Yes. Yeah.
in many high end places as well.
Yes. Yes.
So that is something which we need to look at. And
And
yeah, sugar is often added to most of the things where we don't expect it. Yeah,
I
so
know,
that's
like
true.
salad dressings, I mean,
Hmm. Hmm.
it's shocking. You'll get a
Hmm.
salad thinking you're being healthy. You might as well have
Hmm.
the cake. Um,
Yes.
it's ironic, and it's
Sure.
everywhere. That's also the other part of it, where I think sometimes I feel we just have to rethink our entire lives, because if you go out without carrying food, you go to a canteen anywhere, you'll find
Hmm.
the standard stuff is brownies, patties, sandwiches.
Sure. Sure.
You're really not going to get diabetic friendly food so easily.
True. True. That's very true. Uh,
And what about sugar free? That's also, something which a lot of, I mean, in fact, there are great ice cream brands today which say there's no added sugar. Um, do sugar alternatives also impact your insulin, like aspartame or?
See, they don't impact sugar
Mhm,
directly. They don't
mhm,
have sugar, of course. They are sugar
mhm,
free. The
mhm.
calories are not there. But then there are studies that they can actually stimulate your insulin release, and they can have harmful effects. And also, recently, a couple of months back, WHO had issued a warning
Yeah.
about sugar-free substitutes or artificial sweeteners. They have been associated with certain health problems like cancer and even dementia. Not definite studies, it's not something which is proven conclusively, but there is some indication that they might be harmful. So
Mhm.
excessive intake is not encouraged. But yes, if you want to have it in tea or coffee, so if you want to have it, say, 2 or 3 times a day, that is all right. You can have it that
Right,
much. But do
right.
not do not have desserts cooked in sugar free. It's much better to have a fruit or something rather than that.
Yeah. Actually, the start of me respecting diabetes, I think it's also how much you look down upon a disease and think it's not going to come to you, and, it's not going to affect you. So learning about it taught me how important it is to respect my body and this,
Yes.
beautiful processing mechanism it has. So thank you for sharing all that you have. I think it's interesting to know about the basics. I think that's where we start from. Thank you.
Sure. Thank you. Nice talking to you. Thank you.
Thank you. When I got COVID, this was in 2021, about a few months after that, I came in the range of pre-diabetes myself, and it wasn't surprising because there is a strong family history there. And I changed my lifestyle. I changed what I was eating. I changed how much I was eating outside. I exercised a lot, and I reversed it. And I just want to say that when I came to the normal level again, and I've been there for about 10, 11 months now, I feel more energetic. I feel I sleep better. I feel I work better. In fact, it was when my blood sugar stabilized, that I even had the energy to start this podcast series. So I also feel I'm happier and I process life much better today. Has this episode helped you understand diabetes better? And what other health conditions would you like to know more about? You can write to us at pods@indiatoday.com, or you can message us on 8588 966 We are also available on Instagram, Facebook, X, and WhatsApp channels.